I guess probably to those who actually do stress tests in their clinical setting, right? If you were to have a patient who developed a VT, and let's say it's a very fast VT, but he's still conscious, alert, I would say fairly stable with a low BP, what is the most effective way to handle this kind of a VT? Whether you're in a clinic or you're in a your own diagnostic center, do you shock the patient or do you just lie the patient down and hope the VT will stop? I'm pretty sure some of the audience here would like to know how to handle such a fast VT.
Great question, thanks. So again, it's loaded question because it depends on the type of VT. Mainly, number one type of VT, number one, and number two is the baseline cardiac function. Now, wait, Dr. Cole, how are you? Dr. Cole, your name is here. Okay, so it depends on two factors, the type of VT and also the baseline cardiac function, as I said. So if you have a patient in your clinic, you know it's VT because broad complex, ugly running ECG, you know. Of course, you need to stabilize the patient as in taking the patient blood pressure. And if you're in a clinic setting whereby you have lack of research equipment, you need to arrange, not like, kalam kabut, want to do things, but then like in a quick pace, want to send the patient to a center with facility. Because I always say that VT, given enough time, will become inherently unstable. Now, this given enough time, when, how long time, depends on the second factor, baseline cardiac function, which unfortunately, when we see the patient, we are unable to tell, except asking history. Have you had a heart attack before or not? Have you been diagnosed with heart failure? If the answer is yes with these two questions, then you need to move, you need to do faster already, because it's likely have a depressed LV function. The longer the patient stay in ventricular tachycardia, the higher likelihood the patient is going to collapse. Although at that time, the patient looks stable, because it requires some time, the so-called the cascade of bad, milieu to set up and cause the LV function to go further down, and that cause the cascade of collapse in the patient. It requires some time, but be mindful that you need to do the things, send the patient to a center whereby you can have the research equipment available, and at the end, all VTs must be stopped. So my my previous colleague in the UCLA, they have the badge there, stop VT. They call it VT, stop it. So all VT must be stopped. No VT can be safely left alone. No such thing. Although the patient may appear stable at that moment.
Yeah, thanks for the very